talking about family right now. Michael Stoiko here, talking about, I'm going to do the initials because you told me I'm going to blow the name of this. RSV.
Yes.
You're going to tell me why you call this RSV.
It's respiratory syncytial virus, which is a little hard to say.
Yeah, and it's something that, as you being a pediatric intensivist, we're going to talk about the child side of this, but it's something, too, that an adult can get. Go ahead and just tell us a little bit about what this is and what parents can look for.
Well, RSV, respiratory syncytial virus, is a cold virus, essentially. It's something that every person in the United States catches multiple times during their lives. For many of us, we may have a dozen or more of these infections over our lifetime. Where it becomes a real issue is if you are very young, very old, or have certain medical conditions that put you at higher risk with the infection.
And that's why you were telling me, I'm going to tell you why your kids had this, because as you mentioned, nearly everybody, my kids when they were very young, had pneumonia, and that's one of the signs of this, that I guess this could lead to pneumonia, or do I have it backwards?
No, it can lead to pneumonia. It basically starts out as a cold, and if you're young enough, for example, less than 6 months, or particularly less than 2 months, the airways get very, very swollen and plugged with mucus, and it can produce a lot of respiratory distress. And a small percentage of those kids, maybe 1 in 20 of those kids, will go on to develop a bacterial pneumonia on top of that and can get very sick. And
the tough thing with this is there's no cure for this. There's nothing to really treat it with, correct?
Correct. We have an ability to sort of give it's not an immunization, but we can give antibodies to very small babies, preemies, to help reduce the risk of them getting this. But that medicine is incredibly expensive, and it has to be administered every month during the RSV season to help protect those children. Older children and adults were kind of on our own, and we end up getting sick with this multiple times over our lifetimes.
They're telling us to wrap up, but I want to get this in real quickly if I can. Because this is compared to the cold, what differentiates it from the cold if the parent's at home and thinking, this cold may be something different?
Well, generally what it can lead to is a syndrome that we call bronchiolitis. It can be caused by RSV and other viruses, but what you'll see is your child, particularly your very young child, will start out with cold symptoms, which then progress over a period of several days to more severe respiratory symptoms, the child being unable to eat, child becoming lethargic, and so on, and of course that child needs to be seen by a physician.
Yeah, but I was going to say, and if you always have questions, you don't call me, always call the doc. Good to see you. Happy
Pleasure.
New Year.
Happy New
We'll
Year.
talk after this.